So next instrument is feeding tube or gastric tube, nasogastric tube, right? So this is nasogastric tube. It has a proximal end that has a cap on it. It has a distal end, and that the entire tubing is there, right? So the cap on the proximal end and the entire tubing. Distal end is soft boards on the sides, not on the tip. There are boards on the sides, not on the tip, right? This is to prevent what? Wait a second. This is to prevent that perforation, right? So there is entire tubing is having the blue-green lead line, which is a radiopaque line, which helps us to visualize the feeding tube on X-rays, right? Next is, what are the uses of this? This is all about tube, that it has a cap, blue, green, red line, then the distal end, right? Next in, what is the uses of this? We can use this in, first of all, feeding tube used in the feeding cases if you can't feed it orally, right? Second one is, now for this feeding, if not orally, that comatose patient, where there are various examples in the case of preterm babies, comatose patient, so we can use feeding tube, right? Or if any dental malocclusions and all that, right? The next one is to do gastric lavage, right? Although there is a different tube named as gastric lavage tube, but we can use a feeding tube as well. Next is to take samples for tuberculosis, right? In the case of children, right? Now, next is technique of insertion, right? How long we have to insert it, right? So, to measure the length of this, first of all, place the tip of the tube on the ala of the nasi to tip of the ear, then to the xiphisternum, then that ala of nasi to tip of the ear to the xiphisternum. This is the actual length which we have to put inside the this mouth, right? How to confirm that stomach we have reached in the stomach, that is X-ray. What is visualized on X-ray? That blue-green lead line, right? Next is, we have to aspirate the stomach content. Take a syringe 1 to 2 ml of basically first how to confirm that it is a stomach is X-ray, right? Most importantly. Okay. Next one is other methods are aspirate the content. It will be a stomach content that we are sure that this is stomach, right? Next is take a syringe of 1 to 2 ml of the air through it. Introduce the air into it and then auscultate in the epigastric area. We can hear the air in it, right? Next is neonates में हम urinary catheter की तरह भी use कर सकते हैं इनको. Contraindications in case of varices, esophageal varices. Next is corrosive poisoning. ठीक है, because there is a risk of perforation in these cases, and kerosene because vomiting, because there is a risk of vomiting, which then causes the risk of aspiration, right? So this is all about feeding tube or gastric tube, right? Next one is suction catheter. Suction catheter. This is suction catheter. So how will you differentiate? There is no there is no green or blue lines on it. That lead lines are absent on it. Moreover, the tip is not blunt. Tip is what? Wait a moment. This. No cap. As you can see, you can compare this. There is a cap. There is no cap in it. No lead lines. Hole at end. Right? Hole is at the terminal point, not on the sides. So you can compare with this. There is a hole at sides. Right? This is a Ryles tube or nasogastric tube or feeding tube. Cap on proximal end and lead lines. Right? In the suction catheter, there is no cap. There is no lead lines. And there is no side boards basically. This is used to suck the secretions basically. Is in case of thick secretions blocking the airway, we can suck the secretions, right? Contraindicated in case of unstable child, and again